recognize the member from Nipissing.
Thank you, Speaker. I too am pleased to rise to speak to the Illegal Pill Press Act brought forward by my colleague from Kitchener-Conestoga. We are indeed in the midst of an opioid crisis. Between 2006 and 2015, fentanyl overdose deaths in Ontario have soared by 548%. Last month, we got word that opioid-related deaths rose 19% in 2016 in Ontario. Speaker, you may recall that after 15 fentanyl deaths in my hometown, North Bay leaders came up with the Patch for Patch program. Now, it's a protocol that basically states before you get a new fentanyl patch, you return the used patch undamaged. This legislature adopted it province-wide, and since that time, fentanyl-related deaths have been stopped in their tracks in my hometown of North Bay. It's been zero. I relate this, Speaker, because it's my hope that the same kind of nonpartisan lens can be used to move this bill forward. I want to congratulate the member from Kitchener-Conestoga for taking the lead on this in his community. Last month, he and our leader, Patrick Brown, convened a local roundtable in his riding, which included senior law enforcement officials, public health officials, and community members. When so many preventable deaths are occurring, we need to help protect our communities from the criminal activity of bootleg fentanyl, and one part of the solution is cracking down on illegal pill press machines. Bill 126 would prohibit anyone other than a pharmacist or license holder from possessing a pill press. And Speaker, this legislature heard earlier all the details of this very important bill. But there are other things our party has said we can do as a result of the ongoing and growing crisis, as well as this pill press bill. Release weekly overdose reporting data to the public. Create a ministerial task force to take urgent action to address the opioid crisis. Invest 10% of the $57 million the government spends on advertising on an opioid education program. But, Speaker, Bill 126 is before us today, right now, here, and we can move this bill forward today. Speaker, in closing, I want to read a letter from Sherry Albert of New Liskeard. And sadly, she wrote, quote, "In 2011, I lost my 19-year-old son to this tragic abuse of medication. He was a gentle young man with many plans who was at the wrong place at the wrong time, and as many others did not know the dangers of prescription medication. The police determined that fentanyl was sold to his friend for $100. Since May 2011, I have heard of at least 4 more senseless fentanyl-related deaths in our very small community. I, too, am afraid for our youth. My life has been forever changed and my heart eternally broken by the loss caused by this serious problem. Speaker, it's a reminder there are families just like Sherry's all across this province who are hurting. Their anguish is very raw, very human, and very real, and we in this House need to remember that. Michael Harris's Bill 126 will prevent someone else's death, Speaker. Thank you.
Thank you. Thank you. Further debate.